Hello, and welcome to Anatomy with John and Scully. Today we'll be talking about the brachioradialis muscle, going over origin, insertion, action, innervation, and blood supply. Thank you for joining. So brachioradialis, starting with the origin. We're looking at the right side of Scully. The origin is going to be the proximal 2/3 of the supracondylar ridge of the lateral humerus. It's going to insert from the lateral aspect of the distal radius, right around here. It's going to receive innervation from the radial nerve coming off of nerve roots C5 to T1. So let's count down. 1, 2, 3, 4, 5. Exiting above, we have the C5 nerve root, C6, C6 nerve root, C7, C7 nerve root, C8 below the C7 spinal segment, and then T1 below the T1 spinal segment. It's going to travel down the brachial plexus to form the posterior cord. Okay, so posterior cord is my middle finger here. We'll get a terminal branch called the radial nerve. That's going to come down and wrap around posteriorly, just lateral to the long head of the triceps and the infraglenoid tubercle. And then it's also going to be just inferior to the teres major muscle. That's going to wrap around, come down to the radial groove on the humerus, and then pop back out anteriorly to supply innervation to the brachioradialis muscle. So that's innervation. Moving along to blood supply, starting with the subclavian artery. The lateral border of the first rib is going to turn into the axillary artery. Coming down further, once we get to the inferior margin of the teres major muscle, it'll become the brachial artery. Brachial artery is going to give off a branch called the profunda brachii. It's going to come posteriorly, travel down the radial groove with the radial nerve. It's going to give off a branch called the radial collateral artery. Radial collateral artery is coming down through here, and it's going to come between the lateral epicondyle and the capitulum. At this point, we're going to call it the radial recurrent artery. Wrap around the head of the radius, and coming to its bifurcation of the brachial artery, which gives off its main branch of the radial artery. Okay, so we have the radial recurrent here, and then we have the radial artery, the major highway, and then it comes into its original spot, which is the brachial artery. That will bring us back to where we started. So the blood supply is coming from the radial recurrent artery for the brachioradialis. Moving on to action. It's going to help us to do a little bit of flexion at the elbow when the arm is in neutral. Okay, so mid-pronated is what Netter calls it. So there you have it. Origin, insertion, action, innervation, and blood supply of the brachioradialis muscle. As always, do not forget to eat your leafy greens, and thank you for joining. Take care, folks.